Hello friends, I am Dr. Sandipa. In my channel Homeopath, I will be discussing topics regarding how to practice homeopathy in a classical way and how to cure the patient whichever you get into your practice. The beginning practitioners and all homeopathic practitioners usually focus on the materia medica. So, this is the first lagging of any beginning homeopath or a homeopathic practitioner, because the rules, the key factors, and the required knowledge of the disease and curative process is not in materia medica. We need totality, we need simillimum, we need to follow so many rules and regulations to find the totality of the patient, in each individual patient, to find that simillimum. But we are not focusing on a right aspect so that we can be sure of the medicines whatever we are giving to the patients. All the key factors, all the knowledge required for the homeopathic practitioner is in Organon of medicine. So when we finish up our post-graduation, graduation, we just forget and we will not even touch Organon of medicines. So this is the first lagging of any homeopathic physician or a beginning practitioner. One who is connected with Organon of medicine is a successful homeopathic practitioner. Simply because if you want to treat a simple fever, if you want to treat an acute disease, if you want to treat a chronic disease, what are the required things a homeopathic physician must understand in the patient is totally given in Organon of medicine. Materia medica will help, but application of this Organon of medicine in your daily practice is needed, because many a times we are capable of finding a simillimum, but how to start a treatment in each individual chronic patients differs from patient to patient, and modus operandi changes according to the patients. So this knowledge is given in Organon of medicines. So one who is interested in practicing homeopathy should have a peep of Organon at least once in a day, so that he can understand the basic principles, he can understand what Hahnemann essence of treating the chronic diseases, acute diseases, and understand the nature in its totality which can be applied for our patients, and patient can be cured gently and in a faster way. So a homeopathic physician, homeopathic practitioner should have a look into the Organon of medicine at least once daily, so that he will be refreshing the forgotten knowledge, he will be refreshing the present day situation and what is required for his patients. Organon of medicine is a key factor in our daily practice. So I want to make the beginning practitioners and homeopathic practitioners understand it, that only focusing on materia medica, only focusing on repertory, only focusing on the simillimum will not fetch the real need of a homeopathic physician or the patients. So the satisfaction of curing a patient is different, and just giving a simillimum and palliating the disease is totally different. So one who is very keen in studying homeopathy should focus on organon of medicine. This is all about this session, friends. If you like this video, please like, share and subscribe our channel. In future also I'll be doing such videos. If you have any doubts, please put in the comment section. I'll try to answer. This is all today, friends. Thank you and take care.